After ultrasound, 100% of them become phonetic and distorted.
Things are happening. They're happening to the DNA of these cells. They're happening to the behavior. They're beginning to grow in a funny way. They're beginning to behave in an aberrant fashion. And in some cases, they're becoming tumor cells. There are some long-lived effects on the DNA of the cells, on the behavior of the cells, and on the cell growth that persists for many, many generations after a single exposure.
In your papers, you were showing that you had effects after 10 generations.
Yes, and even longer than that.
It's an instant moving picture of the fetus made by high-frequency sound waves. You can see the baby's heartbeat, spinal column, skull, even the tiny valves of the heart. Doctors call ultrasound a new medical wonder, a way to spot birth defects, improper growth, and problems that may interfere with birth. Some scientists and government officials are concerned that it may be dangerous over the long term. They fear ultrasound is grossly overused on pregnant women, may harm the fetus, and should be limited until they find out whether their suspicions are true. Here's what they say may be the problem. Genetic damage to the fetus that could persist for generations, possibly cancer, and subtle birth defects that might not show up for years.
But potentially it can produce damage to the genetic material, and some of these early studies are suggesting that there is in fact damage induced by diagnostic levels of ultrasound in human and little rodent cells. So our concern is growing.
Dr. Arthur Bloom is a renowned geneticist at Columbia University and an expert on radiation.
If it becomes established that ultrasound is in fact a mutagen, it would also, and most importantly perhaps, or at least equally as important, raise the question as to whether or not it is a cancer-causing agent, because a very high percentage of agents that are mutagenic are also carcinogenic. I'm not suggesting on the basis of the evidence that there is a major effect of ultrasound in terms of doubling the rate of birth defects or anything of the sort. We're simply saying that there may be a low-level effect there that's increasing the rate of congenital malformations that we may never be able to detect on clinical grounds.
Dr. Bloom and other experts stress that so far they have no evidence ultrasound radiation causes harm in human fetuses. But they say we should avoid routine ultrasound examination because we're beginning to see signs of danger, warning signs that in the past predicted medical disaster. One early warning sign is genetic damage to cells and test tubes. We're now seeing this for the first time from low levels of ultrasound. Next, harm to laboratory animals. This too is showing up. Another clue is evidence in humans that something may be wrong. Now, a new government study, not yet released, does indicate that the unborn exposed to ultrasound weigh less at birth. That's a significant signal, experts say, that ultrasound may interfere with normal development. The main researcher who has triggered new concern about ultrasound is Dr. Doreen Lebuskind, a radiologist at Albert Einstein College of Medicine. She exposes animal and human cells to ultrasound waves. She finds abnormal changes in the way the cells look and behave. She won't say the cells are genetically damaged, but she does say the changes look the same as damage caused to cells by 29 rads of ionizing radiation or X-rays. That's the equivalent of about 250 chest X-rays. Here's how normal cells look without ultrasound, growing apart from each other in neat rows. Here's how they look after ultrasound, a tangled mass growing wildly all over each other. Here are other normal cells in motion, with smooth edges moving in a clear direction. After ultrasound, 100% of them become phonetic and distorted.
Things are happening. They're happening to the DNA of these cells. They're happening to the behavior. They're beginning to grow in a funny way. They're beginning to behave in an aberrant fashion. And in some cases, they're becoming tumor cells. There are some long-lived effects on the DNA of the cells, on the behavior of the cells, and on the cell growth that persists for many, many generations after a single exposure.
In your papers, you were showing that you had effects after 10 generations.
Yes, and even longer than that.
Dr. Bloom says it looks as if ultrasound causes genetic mutations.
If a chemical were doing that, we would call that a mutagen.
Government officials are well aware of and also concerned about Dr. Lebuskind's findings. Food and Drug Administration officials candidly admit they cannot say diagnostic ultrasound during pregnancy is safe.
No, I don't think FDA can say. I don't think anybody can say that ultrasound is absolutely safe.
In fact, the FDA for several years has been worried about the effects of ultrasound and done much research on it. In these tanks, they expose pregnant mice to low levels of ultrasound. They find that the offspring of mice who get ultrasound weigh less when born. More important, CNN has learned the FDA has just finished a new study on pregnant women monitored by ultrasound.
We've been looking at a population of children, about 2,000 children who have been irradiated, about half of whom have been irradiated in the Denver, Colorado area. And the indication there is that those children that have been irradiated have a reduced birth weight.
Low birth weight may not sound very serious, but in some cases it's another word for premature. And premature babies more commonly suffer brain damage and mental retardation and are much less likely to survive. Dr. Bloom says confirmed evidence that ultrasound produces low-weight babies would be serious cause for alarm.
Could represent the effect of ultrasound slowing down the rate of cellular growth and maturation. And if that's the case, clearly that's a very undesirable effect. If that were proven to be the case in humans, I think it would really put the brakes right on the use of this procedure for routine monitoring purposes.
You do?
Yes, I do.
Definitely.
I definitely do.
Dr. Harold Fox, an obstetrician, also at Columbia University, says there's no need for restrictions on ultrasound. He believes warnings about the technique would scare the public unnecessarily.
All right, the public often becomes very scared.
When a female fetus is born, all her ova, in other words, all the eggs for the next generation are present at the time of birth. And therefore, when you subject a female fetus to ultrasound near term, you have not only subjected her cells to ultrasound, but also all her eggs for the next generation.
Jean Carper, CNN, Atlanta.